just to see the ridiculous and stupid things they were saying about cannabis, except they don't call it cannabis. They say it's marijuana, and this is where the word marijuana enters the Australian vocabulary. It's not till 1938 that the word marijuana is known in Australia. Before then, there was medical cannabis, and cannabis was one of the most important drugs of the time, if not the most important. It was a part of the most popular medicine in Australia, J. Collis Brown's chlorodyne. And so what the Americans did was they renamed cannabis indica, and that's what drug cannabis was called in 1938. It was known as cannabis indica. And they rename it as marijuana, and then they start this, propaganda campaign about the evils of marijuana, which has gone on for almost 8 decades now, 8 decades of lies. And so we rarely use the M word as cannabis reform activists. We always talk about cannabis rather than marijuana. Anyway, so that's who I am. Now we're here to welcome Dr. Andrew Katelaris, who's come up to do this talk. Andrew is going to be talking about the science of cannabis and cannabis's extraordinary powers as a healing herb. So could you please welcome Andrew Katelaris?
Thanks very much, John, for organising this. We're going to talk about the science of cannabis, but first we're actually going to talk about the non-science of cannabis, and that'll be the first part. Okay. Now, is that a truth or is that a lie? The allopathic medical system bases all its practices on carefully obtained and balanced evidence. Let's examine a few examples. Okay. This is the Lancet. Now, even though they I selected deregistration in 2005, I still get a copy of the Lancet sent to me every month. This is this month's copy. I nearly fell off my chair when I was just wondering how to introduce this talk about the problems with allopathic science, and they actually gave it to me there. They're talking about the treatment of brain melanoma, and look about in the middle of the thing, they're saying it's usually been surgery or radiation, though neither have been properly examined in clinical trials. Right? Just let that sink in for a minute. We've been irradiating people's brains for decades, and now the Lancet, the premier medical journal of the world, I suppose you'd say, is admitting that there's been no trials to actually examine the efficacy or danger by itself is enough. This is a product information leaflet from the Fluaval, or the flu immunisation. Can you read what's written down there in the highlight, in the yellow? Oh, help.
No, you can't. There has been no controlled trials adequately demonstrating the decrease in the incidence of influenza as a result of this product. Right? The only thing they've done to justify the billions of dollars that governments of the world and individuals are spending on these this particular type of immunisation is demonstrate an antibody rise in the people. It's the same as doing the saliva testing for cannabis. They can demonstrate people have drug in their bloodstream while they're driving, but they fail to identify that there's any impairment. But here at the opposite side of the coin, we're being exposed to an increasing compulsion to take any range of immunisations that haven't been adequately tested to produce the effect claimed. And that's a very important point. Okay, there's plenty of other times when evidence has been sadly lacking. Those of you old enough can remember the Halstead mastectomy. For those that don't remember it, and it's something that would give you the horrors, it was the initial approach to breast cancer. It was dreamed up by an American surgeon in 1898 called Halstead. And because he had a loud voice and he was a very imposing person, he basically imposed his method of dealing with breast cancer on surgical practice, and that went on for about 60 years. It involved disfiguring surgery, gouging out the pectoral muscle, completely removing the subcutaneous tissue and the lymph nodes. the morbidity was huge, massive lymphedema, recurrent infections, and 60 years later, when someone actually bothered to do a balanced and controlled trial, guess what they found? You got no survival advantage by doing this deforming operation than by doing a simple lumpectomy. So for 60 years, a countless amount of suffering based on an opinion unsubstantiated by any sort of empirical science. Something as simple as a dog bite. In my 25 or 28 years of medical practice, a lot of that in casualty, the debate still raged, is it best to suture a dog bite or not? I would have thought by now we would have got that sorted out. But it comes in waves. There was 10 years where you don't because it'll get infected, and then 10 years later you do because it'll get infected. And now you can do what you want because no one's bothered to do a proper trial. CPR, pulmonary resuscitation, it's been in practice, it's been taught to countless people for decades now, but now it comes out when someone bothered to do a controlled test, the breathing part adds no longevity or no success to the whole procedure, and they've actually rethought the way it's done. How did those guidelines get so entrenched that they're actually photocopied and put on everyone's pool fence and things like that, when it actually makes no difference and it could have easily been determined with a little bit of empirical investigation? Okay, in a like manner, the cut, burn and poison approach to neoplastic diseases has only ever been compared to similar treatments, but has never been compared to a holistic treatment or cannabis treatment or any other modality whatsoever. In those few times back in the 60s when it was found that focused meditation could produce an effect better than chemotherapy. And that's the work of Ian Gawler, and that's been pushed down into the shadows of history.
For your ABC, big cheer for the ABC, mate.
There's three identical maps of Ireland. You'll just have to take my word. Here's Northern Ireland up here, and the border runs around there. Down at the bottom here is a scale. At the purple end of the scale is high incidence. At the lower end of the scale, the green end, is low incidence. Each of these refers to prostate cancer, leukemia, and pancreatic cancer. So basically, a doctor by the name of Declan Waugh, W-A-U-G-H, Declan Waugh, has taken publicly available health statistics and compared Northern Ireland, where there's no fluoridation, with Southern Ireland, where there's compulsory fluoridation. You couldn't make it, you just have to take my word, these are green, right? You go and look on the internet to make sure that I haven't unhinged my mind and telling you falsehoods. But the evidence for the danger of fluoride is screaming at us, and yet someone like Plibersek, when she was health minister, said, oh, we consider it's the single greatest health initiative that this country's ever taken. That's the sort of people that we're allowing to govern us. I wish that was clearly seen, but you've got to take my word and confirm it for yourself that the adverse health effect, and one of the leading reasons for the progression of the cancer epidemic we're now having, is iatrogenic. It is the fluoridation of the water, and just to add insult to injury, they're actually using fluorosilicates sourced from the Shanghai Rock Phosphate Company as a waste product of phosphate fertiliser manufacture. Right? You couldn't make this stuff up if you tried. All right, thanks. All right, I want to briefly talk about different types of medical studies, because scientifically and morally truncated people talk a lot about the need for trials without actually understanding what they're talking about. There's plenty of different types of trials, and they're each designed to have a specific function. Now, the first ones you can do are longitudinal studies. That's where you'll follow, say, health outcomes in children, and you might follow them every 7 years for 21 years or something like that. That's a longitudinal study. You can have a snapshot or a cross-sectional study where you go and look at all the 7-year-olds and just see where they're all at, but without a longitudinal. There's observational ones versus controlled. By that, the observational ones, people do what they want and you follow them. Do pot smokers get more lung cancer? Do new drinkers get more liver cancer? They're observational studies where you're not intervening in what's going on. You're observing it versus a controlled one where you give a person a certain drug or treatment and see where they go. Now, they always talk about phase 1, 2 and 3 clinical trials. It's pretty simple. Phase 1 is meant to be when you give the substance under question to a group of normal people or people unaffected by the disease to detect tolerability, toxicity and some sort of dose response of tolerability. Phase 2 and 3 are larger trials. And the big difference here, the last two, is what they call open label, where everyone knows who's getting what, or the famous placebo-controlled, randomised, double-blinded crossover study, described by the allopathic system as the gold standard. It's not the gold standard of anything except comparative studies looking at small differences between similar drugs. So the classic case, for instance, someone puts out a beta blocker blood pressure tablet. There'll be beta lock, and they'll do their little study and say, look, we've got a 20% reduction in blood pressure. We're a success. But someone will come out with labetalol. They've added a little molecule here or there, and they'll get a 25% increase. So we're the leading drug. The whole idea of these placebo-controlled, randomised crossover studies is to detect small differences. Is it suitable for looking at the medical effects of cannabis? No, for a number of reasons. Firstly, we use whole plant extracts in our therapy, and we customise the extract depending on the condition as being treated. For instance, if I'm treating a child with intractable childhood epilepsy and no other associated conditions, we almost always start with a CBD dominant cannabis, usually in the form of CBDA, and then we run through an algorithm depending on the responses. But my experience has been that if you add too much THC, for instance, to a CBD cannabis with some of these children, you provoke seizures. And there's a reason for that, probably based on the fact that there's an unbalanced CB1 receptor stimulation on these children, whereas CB1 and 2 are equally stimulated by CBD. So there's a difference in effect. And we customise. My attitude is that these little children with a life-threatening disease are not lab rats. There was already a courageous mother in Tasmania who said, why would I subject my child to a placebo-controlled trial when I'm very well controlled on the herbal medicine that the kind fellow up in the hills is growing for me? Why should I do that? And I agree with her. Why should you? The children are not lab rats. We're not here to prove that cannabis works better than Epilim or Dilantin or Zigabatrin or Clobazam or all the other poisons that they throw at these kids on massive price scales. We're not there to do that. We're happy that we treat the person, we minimise the toxicity by reducing the allopathic drugs, and let the parents decide what's the best treatment. We don't need to have it published in the Lancet. You've already seen what the Lancet are admitting to. We work directly at the human level with the parents and the child, and that's where it needs to stay. Having said that, if they want to run a medical cannabis trial with seizure disorders, I would demand that we get an equal cut of the pie, i.e. we get half the patients to treat our way, and not only can they compare GW Pharmaceuticals with Uncle Blog's whatever, but the way we manage it, which integrates family therapy, because that's very important, nutritional therapy and cannabis therapy. So we don't treat the kids like lab rats to make an academic point. We're human trying to do the best that humans should do. Okay. What's wrong with the randomised placebo-controlled double-blinded studies? As I said, they're designed to detect small difference between similar drugs, generally to gain commercial advantage over the competition. I've already said that a single drug is not what we're after. We don't want to prove that CBD as a monotherapy is better than this or that. We want to quell the seizures and allow the child to develop to their full potential. And as I said before, that involves physical, nutritional and psychological therapy. And it's not done by some turkey in a white coat with a clipboard. There has to be a lot more warmth and love in the process, I think, than that. Okay. Of course, privately owned and monopoly controlled media is the best organisation to form public drug policy. You saw an example on the wall there that John put up. Let's see where the past has been. Yeah, sure. No, next one, please. Smoke a fresh cigarette. There it is. Not only is he a doctor, he's an ENT doctor. There he is with his little indirect laryngoscopy lab, right? Give your throat a what? A vacation. Give your throat a vacation. Give it a rest from the benzpyrene in the Camel cigarettes. This is as late as the 1950s. So I'm now confronted by a criminal group in the AMA trying to hose down the medical applications of cannabis, whilst just 60 years ago they were so ignorant and so devoid of any insight, they allowed the profession to be used to promote cigarettes. Let's look at the next one. More doctors smoke Camel than all the others. What a lovable man, but a lying bullshit artist. Okay, I'm sorry this is so poor quality, but it's fascinating. Look, the docs are out there on the right smoking the Camel, but it's all right for the mum. She can go and get the Philip Morris. That'll help the baby. You couldn't make this stuff up. These are published advertisements from the 1950s. Okay, next one. Oh, now, I like this one, right? All over America, more scientists than educators smoke Kent with the micronite filter. That sounds like a really catchy advertising. What's in the famous micronite filter? Does anyone know? Asbestos. That's why they're not talking about it anymore, right? The famous micronite filter died a quiet death when they realised they were getting non-occupationally exposed mesotheliomas, right? So much for the educators. Okay, it's not only cigarettes. Look at this. Better start in life. Start cola earlier. You want to get type 2 diabetes before the next one, don't you? Right? Don't be late. How soon is too soon? How mother and baby picked up Blatt's beer for the bub. Read it. A case of Blatt's beer in your home means much to the young mother. Why, she can sit there and watch Days of Our Lives while she pickles a liver. Does wonders for the breastfeeding as well. I'm not making this up. These are the people that are this takes a cake. Restoring sex power. Shove a pellet of radium up your ass, right? This is exactly what they're saying. Admittedly, this was in 1910, right? How many rectal cancers by wannabes trying to restore their sex power, I don't know. But then along came reefer madness, right? It took the cake. Not only is it bad or dangerous, we've got the devil himself carrying off these hapless victims. Insanity, vice, degradation, sex orgies. I thought, when I saw that as a teenager, I thought, yes, finally, I've got to get some pot. Okay, next one. Assassin of youth. Okay, wild medicine thrills. Take the next one. There's always... Now, a weed from the devil's garden. Look how they put pejorative terminology. We laugh about this now, but children and adults are sickening and dying because the Randolph-Hearst Press vomited up this garbage and the Murdoch Press continues to do so. Right? I mean, you've all read 1984, We're Living in It. They've just put the iron fist in a velvet glove and poisoning your mind this way. Look at this one, daring drug inspection. Needles? Never seen anyone inject cannabis except the cowboys at the wellness clinic, which we'll talk about soon enough. But they're not associated with needles. Why have they done that? They're conflating the narcotic use with cannabis use. Shame, horror, despair. I mean, these are very, very pejorative terminologies. Weird orgies and wild parties unleash passions. I'm still waiting. The pot must have been a lot stronger then. All right, of course, we all know it's all about the money or the power that the money brings. Now, leaving aside, I'll just give you a few reality checks about the world we're living in. If you line up the 50 biggest companies on this planet by their financial scale, their financial size, you get to number 49 before you find a company that actually has a physical good for sale. The first 49, it's the 50th, the first 49 are banks, insurance companies and financial institutions. What have they done for us? Except saddle us with unpayable mortgages and unreasonable bills of all forms. But yet, the 49 biggest companies in this world are dealing with abstractions rather than reality. Okay, here's part of the story. John mentioned the Reefer Madness campaign, but what was the backstory to the Reefer Madness campaign? It turned out this, you can read that there, the new $1 billion crop. That was published in 1937 in the Popular Mechanics magazine. Popular Mechanics is not known as one of the more radical or left-wing publications around the world, but yet in 1937, you can get this online, this article, it was published saying, don't prohibit cannabis. Just take it one, sis. Just next one. The discovery of this machine, this is the Schlichten decorticator, and it was revolutionising the production of hemp and dramatically lowering its cost. So they literally thought hemp, which had been held back industrially because there was no mechanisation and it was done by generally black slave labour in the US and other places like that. Without slaves, it was very hard to hand process the hemp. When the Schlichten decorticator came along, the hemp industry said, whoopee, we're all going to be millionaires. Except the Randolph-Hearst Press had other ideas, and it had nothing to do with the drug cannabis. That's something you have to understand. That is an entire smokescreen. What it had to do was destroy the industrial potential of hemp so nylon and the other hydrocarbons could get into the market. And that's exactly what happened. The world changed in the 1930s when the petrochemical barons basically took over the world and changed us from a carbohydrate or a sun-powered world to a hydrocarbon or chemical world. Okay. This takes the cake. Can you read that? Ford's hemp car. One of Henry Ford's first cars ran entirely on hemp fuel, ethanol, and the body was constructed by a hemp plastic. It was stated to be 10 times the impact resistance of steel, but 1/6 of its weight. You show the next one. And there's Henry giving it what for with a sledgehammer. Wouldn't it nice to be able to hit your car with a sledgehammer and not have a $2,000 panel beating bill? That's the way it was. They sank this technology. We wouldn't have a greenhouse or a climate problem if this single invention hadn't been sunk. Because the world would be growing hemp, making hemp fuel, making hemp plastics. You imagine the cost of your cars. No rust, no panel beating. The whole disaster could have been avoided. We're in the grip of avaricious psychopaths, and I say that advisedly, avaricious psychopaths, because what's the point of what they're doing? Degrading the forests, the reefs, the oceans. What is the end game? That's why they're psychopaths. They don't have an end game. Okay. From 1850 till 1937, cannabis was used as a prime medicine for more than 100 separate illnesses or diseases in the US. As John mentioned, there's the indica stuff. That's why they had to change the name to marijuana. Because if you said, oh, we're going to ban your cannabis indica, they said, oh, but the baby's using it when he's got a fever and mum uses it when she's got the migraines, dad's using it when he's had a bad day after work. In 1858, a recipe to make hash oil using an alcohol extraction very similar to our current method was published in the Australian magazine, Australian newspaper. Right? It was an accepted part of the whole of life. They had to create this monster of marijuana using the full force of the Randolph-Hearst Press. Okay, sister. I suppose half of you in this room have heard about this. This is the patent that the US government, via their Department of Human Services, attempted to place on CBD or cannabidiol in something like 1988 or 1989. So here was a drug, a plant from which it is derived, had been repeatedly labelled as having high potential for abuse and no capacity for medical use. Here's the US government putting a patent on it, and look what they say it's good for. Particularly good in application as neuroprotectants. So if one of your parents has a stroke, the first action you should do is load them up with CBD cannabis, and you'll minimise the amount of neurological deficit. The US government knew about this in 1985. We only found out in 1990. But it's a tragedy of, look at the list there, strokes, trauma, neurodegenerative diseases like Alzheimer's disease, At the same time, they're maintaining a prohibition based on there being no medical effect. In fact, that's why they didn't pursue the patent. They couldn't think it through that the DEA and their patent are contradictory. All right. Why does cannabis appear to have such a miraculous range of therapeutic effects across a whole range of diseases that seem completely unrelated? Things as widely different as childhood epilepsy or Crohn's disease, inflammatory bowel disease, Alzheimer's disease, post-traumatic stress disorder. These things seem to have nothing in common with each other. To understand the role of cannabis therapeutics in those, you have to understand, I'll just take a few minutes it's not a very good diagram, but this is a small section of a cell. The body's composed of billions and trillions of these cells. Each one is similar in structure in that it has a cell membrane, which is a phospholipid, and through the cell membrane are these receptors. Okay, just keep that in mind. So the cell talks to the cells next to it by excreting messages which then bind to receptors. The receptor works through the cell and affects a change, like it pumps out calcium or pumps in potassium. Whatever the particular receptor is primed to do, it will do it. Okay, Sid. The endocannabinoid system was discovered by Ralph Mechoulam and his colleagues in Israel after several years of research. It was interesting. They didn't realise it at the time, but it was a US government medical grant that Ralph Mechoulam conned that got him started. So the endocannabinoid system, which is going to revolutionise human therapeutics, totally revolutionise, the change from pre-cannabis to widespread use of cannabis will have a much bigger positive impact on the population than it did when antibiotics were introduced. Right? It's that transformational. That's the way I see it. Now look, over there on your left, you see a part of a synapse. At the top is one of the nerve fibres coming from the top part of your body, and down there is a nerve fibre that receives a message and travels. Now, almost all our nerve impulses simply run in one direction, just like a one-way road. They run down this way. But with the discovery of the endocannabinoid system, this is what happens in the endocannabinoid system, and this is why it's so amazing. There. That's what we call the postsynaptic membrane. Now, say for instance, it's all right. All right. Say for instance you have a bit of a fright, and you know your adrenaline's out there and your knees are knocking and your heart's beating and things like that, and you're still pumping adrenaline down. There has to be something to say, okay mate, it's not that bad, the Mack truck didn't get you this time, relax. What happens, as far as we understand, for some intelligence in the body manifests the anandamide, which is the endocannabinoid. Now, just briefly, so you understand it, endo just means inside of the body. So there's 3 different types of cannabinoids. The endocannabinoid, which is made by your body that binds onto the receptors. The phytocannabinoid, which you get from plants, or the synthetic cannabinoids, which a chemist make in the lab. They all bind to cannabinoid receptors in different ways and have significantly different effects. But their commonality is that they bind to these receptors. The receptors occur on the presynaptic membrane. Unlike the signals which run this way, the endocannabinoid system is a retrograde system, and it's a way of the downstream cells communicating with the upstream cells to regulate and moderate their behaviour. Okay, it's an essential mechanism of homeostasis. That's the function of the endocannabinoid system. And it's not restricted to one function. Homeostasis means maintaining a balance, and it maintains the balance across all the systems at the very cellular level. So it's essential in cell-to-cell or paracrine communication. Now, why are we getting epidemics of disease that we haven't seen before? Things like autism and upswings in asthma and all the rest of it. There appears to be, and this is speculative, but it's speculative based on reasonable science, there appears to be evolving a condition across humanity who's living in a Western lifestyle. It doesn't apply to humanity that's living in an organic, natural lifestyle somewhere else. But we're developing widespread endocannabinoid deficiency. And the absence of the endocannabinoids, we lose our homeostasis and the body simply doesn't function. It is becoming apparent to me although this is still an evolving science, that in order for you to make this anandamide, the anandamide is a chemical messenger which is made from the cell membrane when it's needed to tell the other cell to calm down. So the downstream cells, it's like me, pulls off a little bit of myself, throws it up there, say, hey mate, just relax. Okay, that's the way it works, it seems. But if you don't have, for the last, say, 7 years, you haven't been eating the right fats and lipids, you've been down at McDonald's getting your full share of trans fats and esterified bloody hydrocarbons and all the other weird things that they put in the food, your cell membranes can only incorporate what you offer them. So if you're not offering them the right essential fatty acids, the membrane is not properly formed, and when it's called on to produce anandamide, you don't have the substrate, you don't have the necessary fatty acids to produce the messenger, so the message fails and your body spirals out of control. How do we fix it? Hemp seed, right? I'll talk about this till I run out of air, basically. Hemp seed is the single most nutritionally dense and balanced food available to humanity. The fact that it can be grown in an organic fashion very easily on a plant which produces all the textile and short fibre uses for humanity. Yeah. Hemp seed. It's very rare in a food today to find a food that's demonstrably hypoallergenic. At this stage, no significant food allergy has been demonstrated to the hemp, largely because it's completely untouched by agricultural chemicals. But also it has a perfect balance of omega-3 and 6 and the essential cofactors, the B group vitamins, the magnesium, the zinc, the manganese, and other cofactors that are necessary for the organism to absorb and utilise it. The trouble with allopathic medicine, they talk about, oh, we did a trial on fish oil, we did a trial on that. In other words, they fed it to someone, but it's more than just taking something in. It has to be absorbed to be effective. And this is why they're getting such contradictory results from a lot of the nutritional studies. Oh, we tried antioxidants, we tried vitamin E. Things like this are nonsense because they're starting with groups that are very disparate in their nutritional status. So how can you compare an outcome? Someone may have been very well nourished with a surfeit of phytonutrients and another very deficient. Their vitamin C status, their oxidative status can all be very different. And unless we address our therapies to the underlying biochemistry, we're forever going to be treating symptoms. Okay, next one. Iatrogenic illness, from the Greek word iatros, meaning doctor. A iatrogenic illness is a doctor-caused illness. It's currently the 4th leading cause of death. Right? Now, people manage to shrug that off and say, hang on, wait a minute, the 4th leading cause of death is the treatments that your doctor is giving you. And they're worried about the safety of cannabis. Right? We are surrounded by a legion of moronic hypocrites. And they've been parroting the same lies indefinitely, but to the detriment of humanity itself. Look at this. Synthetic narcotics, oxycodone. 46 people a day are succumbing to oxycodone in the United States. We found as early as the 1990s, and we weren't the first ones to do it. It's been described for decades before that. You can dramatically reduce the amount of narcotic, morphine or pethidine or whichever narcotic you're using, dramatically reduce the amount of narcotic needed to control pain by co-administering cannabis. They are what they call symbiotic. The cannabis provides useful pain relief, anti-spasticity, anti-nauseant and appetite stimulation and counters some of the effects of the narcotic. But by reducing the amount of morphine used, we can maximise the pain control and minimise the side effects. And I demonstrated this dozens of times. We got people's morphine dose down from 80 milligrams to 20 routinely. Even if we couldn't cure their underlying pain condition, we routinely derived at least a 50% reduction in narcotics and a much better improvement in the quality of life, not to mention savings of money. Okay. This isn't the drug your mama warned us about, oxycodone is. You've got to believe it. Right? The fox is minding the pigeon when it comes to your health. They release these Everything that we were told. You remember Panadol, gentle, safe to the stomach, paracetamol, in pain persist, see your doctor. It's now recognised as a dangerous hepatic toxin. The difference between a therapeutic dose of Panadol in the long-term queue 4 hours and toxicity is very narrow. And we've probably been placing a huge oxidative stress on young kids' livers and having them recover despite our treatment rather than because of it. In the future, in an enlightened world, cannabis will not be seen as the last resort for the hopeless cases. I'm happy that we start with the last resort for the hopeless cases and make them hopeful, which is what we do in many examples. But in the future, cannabis should be used freely across a range of illnesses, starting very young. The youngest child I've treated with CBD-dominant cannabis oil was 4 weeks old, with benefit. So I'm not afraid of cannabis and its use. Okay. All right, the current medical uses of cannabis. Pain and spasticity, I don't think there's any room for debate about its use in pain and spasticity. Ask the patients. What is wrong with asking the patients? And that brings us up to this nauseating escape that the AMA and the other authority figures have of anecdotes. Oh, but it's all anecdotal. We've turned up with the case histories of several of our Dravet patients, and you're all familiar with Dravet syndrome from Charlotte Figge in the United States? Okay, Charlotte Figge was a 5-year-old sufferer of Dravet syndrome, D-R-A-V-E-T. It's intractable myoclonic epilepsy of catastrophic myoclonal epilepsy of infancy. And the name says it all. If you call a disease catastrophic myoclonal epilepsy of infancy, you get an idea of just how serious it is. And it is serious. I mean, we're talking dozens of seizures. We're talking about progressive loss of capacity, the inability to speak at 6 and 7 and beyond, and an early death. Right? Not only does it affect the child, but it draws the whole family and the other siblings into this whirlpool of anxiety and midnight rushes to the hospital and coping with toxicity of drug trials and blistering skin reactions and urgent blood dyscrasia set out by the drugs. We're talking a really, really nasty and serious illness. Anyway, Charlotte Figge's father, despite his ex-Marine I've had a dialogue with him, he's a nice fellow. He sourced some high CBD cannabis, and long story short, the child went from being wheeled around in a wheelchair to riding a push bike in 3 weeks. And she's remained well now 2 years later. We've duplicated that dozens of times. It's not a rare thing, it's the norm. They say it's only anecdotes. I've turned up at Ingrid Sheffer's conference on Dravet syndrome without clinical histories. They wouldn't allow us to have the microphone to talk about it. Right? We're dealing with naked financial competition. I've said some feral living out in the hills behind Mullumbimby or something like that can produce a safer and better medicine than every drug company this planet is currently seeing. And the sooner we actually recognise that as a reality and stop hiding behind a false shield of we're actually concerned about safety, we'll make progress. All right, okay, no, that's all. Okay, leave them on to help me. Inflammatory bowel disease. This is really exciting because Crohn's disease and inflammatory bowel disease, when I was a young medical student, I had the experience of actually living, like sharing a house with someone with inflammatory bowel disease. And other times you read about a disease and you read about it in your textbooks and you look at the slides under the microscope and you think, I've got a pretty good idea what's going on with this disease. But when you live with someone with a disease, you realise what inflammatory bowel disease means. It's not just the pain and the blood and the anemia and the indigestion and all those sorts of things. It's the fact you can't go more than 20 minutes away from a toilet, and you've got to plan your trips so you can have toilet breaks. It just dominates your life. The treatments, steroids and other things like that, are highly toxic in the long term and don't control the disease. We're finding CBD-dominant cannabis can make a dramatic difference to these people's lives. And when there's nothing better to offer, why not offer it not only, again, as a last resort treatment, but as a first resort on presentation. We'll know our movement has been successful when we're getting these patients on presentation, not on their 7th relapse. Okay, epilepsy. We probably said enough about that. Cannabis dwarfs the therapeutic effects of all other anticonvulsant drugs combined. I can say that fairly bold statement, but it is demonstrably true by my experience of 2 years, because routinely the patients that we are brought to us are on 4 or 5 medicines. Most of them have tried at least a dozen other medicines. They've gone through, oh, let's try this, let's try this, let's try, oh, I can't have that one. It gave her the blistering rash last time and she spent a week in hospital. Oh, you can't have that one, that made her anemic. Right, and we go through them like this. 90% of the children that are brought to me after a stabilising period, and especially if they take on the dietary guidelines, end up better than 80% seizure free. And we appear to be getting results that are twice as good as the published results from the US studies. They're claiming a 40 or 50% seizure reduction. We're getting more than that. The irony is the allopaths claim success when they get a 20 or 30% reduction in seizure intensity. They say, oh, it's a successful drug treatment. We consider anything less than 80% response our failures. Right? So we're operating on different scales. Okay, the big thing is cancer at the moment. Now, later on in this talk, we'll be hearing from Lanai about her very real experience. Real experiences with cancer. What I'm going to do in the next 5 or 10 minutes, 5 or 10? Good, yeah. Is talk a little more specifically, because I said before, we're in the middle of a cancer epidemic. We're not in the middle of it, no. Unfortunately, I fear we're at the cusp of a cancer epidemic. And that makes it very sad because it's a very steep cusp. I've had 10 years away from clinical medicine from 2005. Before that, I was working at North Shore Private Hospital, and I had a lot to do with cancer patients. I was mostly there to look after the complications of the chemotherapy, which I got a bit sick of doing, I have to say. But in the period that I've been away from clinical medicine, the behaviour of the cancers appears to be dramatically more aggressive. We're seeing cancers that I was used to seeing in older people, the pancreatic cancers, things like that. We're seeing them in 30-year-old women. We're seeing bowel cancers in 19 and 20-year-old children. Right? These things I hadn't seen before. Admittedly, we're in a place that may be attracting the more severe ones, but there is a real effect going on. The government's boasting that 1 in 3 of us are going to have cancer now, but in the future it's going to be 1 in 2. What sort of health policy is that? Right? It doesn't have to be, but we're heading down a very steep and slippery slope. So the incidence and the frequency and the intensity of cancer appears to be getting worse. I describe myself as a Hippocratic physician. That's the way I picture myself, because I actually adhere to the Hippocratic ideal of treating, where it's primum non nocere. That means first do no harm. So by definition, you really shouldn't give chemotherapy, because that's operated on an entirely different idea of risk versus harm benefit. Now, to a point, everything is a risk versus harm benefit. Taking out someone's appendix is a risk-harm analysis, but the benefit clearly, like 99 to 1, outweighs not doing something. In the chemotherapy, it's nowhere near that clear cut. And unfortunately, no one has actually measured the usefulness of chemotherapy against doing nothing at all. We have patients with breast cancer, untreated except for some dietary interventions, that are going 10 years later, whereas most of the chemo ones are dead. It does appear we've got to a stage where the chemotherapy, certainly this applies in the gastrointestinal tumours, less so in some of the others, but in the gastrointestinal, of the gut, the bowel, the colon, having chemotherapy appears to shorten your life expectancy over having nothing. And it's not actually been rigorously tested, and that's to the crying shame of the system. At some stage, we'll get enough confident people newly diagnosed with a disease where we can have them before their cancer's been subject to deep X-ray therapy. And the exposure of cancer cells to deep X-ray therapy guarantees that those cancer cells become virtually untreatable. You can Google this again. It's called cancer stem cells. The impact of radiation, ionising radiation, on cancer cells is to immortalise them, is to make them nastier and more resistant. And this does appear to happen with cannabis as well. We've had cases where we've cleared tumours with cannabis therapy only to see what I call a clonal breakout, because it's increasingly understood now cancer's not one thing, it's a group of related clonal cells that can further mutate and become more and more resistant and more aggressive. You can watch this under the microscope as the tumours devolve and the patient's ultimate demise is what comes. I have to say, and I do want to give a cautionary note about the use of high-dose oral cannabis in the treatment of advanced metastatic disease. A lot of people are having cannabis therapies more or less forced on them by concerned relatives in the hope that it'll make mum's stage 4 lung cancer get better. It may make mum feel better about her lung cancer, and our experience is it certainly slows the progression of the cancer, and that appears to be for two reasons. It does appear to interfere with the blood supply of the cancer by inhibiting new blood vessels being formed, and it also increases the tightness of the junction of normal cells, the intracellular adhesion, so the mets can't take root. Now, with the exception of primary brain cancers, which appear to respond fairly well to cannabis therapy and something that should be urgently investigated, I've been trying to get a GBM or a glioblastoma multiforme trial going at North Shore Hospital for 3 years now, but we haven't got it through the ethics committee. We simply want to add high-dose cannabis to the current regime and just see, but eventually we'll get that, we're getting closer. But some cancers do well with cannabis. The primary brain cancers appear to be one. Part of the reason for poor responses of cancers to cannabis appears to be, firstly, the cancers generally have a very poor blood supply. The exception, like the primary brain tumours, because the primary brain tumours run along blood vessels, it's relatively easy for the medicine to get to them. But if you've got a solid lung tumour, it's got a relatively poor blood supply, and the cannabis can get all through your body, but it won't soak into the cancer in any meaningful way. Now, having said that too, there can be an intrinsic resistance to cannabis and the cancer cells. This is sad. I was really hopeful we'd have much more impact, but I've become a little more guarded in what I say about the use of cannabis for cancer now. Mainly, it's very useful as an adjunct to treatment. In certain cancers, and I'll include primary brain and the hematological malignancies like leukemia, where they're exposed in the bloodstream and the blood levels are much easier to attain, they should be going full on, make all the effort there. But with the others, I prefer to rely much more on a drastic nutritional approach to cancer and use the cannabis in lower doses to enhance the person's well-being rather than fill them up with this legendary 1 gram from the Rick Simpson method. I've seen a couple of responses to Rick Simpson therapy over 2 years, but it's been dwarfed by the non-responders. So it's not a magic bullet. And the reality is, the cancers that we're experiencing are lethal. And I mean, daily we're getting death notices from people we've been associated with. Childhood osteosarcomas, PNETs, all these rare tumours are becoming less rare, unfortunately. And at current state of the art, we often don't have the answers, and we have to fall into caring mode. So the only true cure for cancer is prevention, and the only true prevention is to heal the environment. We have to start from the soil and the water and work upwards, but that's not happening. We're fighting a losing battle with psychopaths that want to convert Australia into a gas fracking colony and blast channels through the barrier reef. I don't believe in the death penalty, but I'll make exceptions for people so lacking in moral rectitude that they can actually plan these sorts of things, knowing that they're going to have a tragically detrimental effect on not only on this generation, but future generations. Now, should we do questions, John?
Yeah. I suffer from post-traumatic stress disorder, and I'm seeing a psychiatrist at the moment, and I don't know if I'm allowed to, if I should continue using cannabis or if I should stop my medication that I'm on. I'm in the middle of a dispute because legally it's not legal here, so I don't know what to say to my psychiatrist and what to do with my regards to medication. And from the CNN documentary Weed 3, I saw it was only smoked, the cannabis. They go into the dispensary and ask, do you want a euphoric feeling today? What do you want to feel better? So I don't know, what do I do if I want to use it medicinally?
Okay.
Yeah,
the question basically is, what's the place of cannabis in the management of post-traumatic stress disorder? In the United States, because of their penchant for sending their young men, rather than giving them gainful employment, they give them M16 rifles and go over and kill a few third world people as job experience. They have armies of people suffering with brutal post-traumatic stress disorder. I mean, some of the things that they've done and seen done are enough to sort of unhinge the best of us. In fact, one of the main reasons I feel that they've loosened up on the medical cannabis is because they've got too many vets to treat with post-traumatic stress disorder and nothing else is working. Like, firstly, I struggle to find a sane psychiatrist. That's the first thing. I mean, them and their drugs. No, it might be a cheap shot, but I struggle to find a truly sane psychiatrist, right? I mean, it's a non-science. Their SSRIs are non-science. They're commercially driven poisonings. Now, as far as post-traumatic stress disorder, and there's a couple of really worrisome things I'll just preface before we finish with your question. In the United States, there's a group called DARPA. Has anyone heard of DARPA? Yeah, it's sort of like the well-funded science spooks that are inventing the next range of horrors for us to suffer with. They're worried about their troops getting post-traumatic stress disorder, so instead of not sending them out to slaughter the third world peasants, what they're trying to do, they're experimenting with drugs that if they take them in advance and then blow a child apart with a hand grenade, they won't feel bad about it. They're doing what I call a moral lobotomy on their troops. The next thing is they're going to replace all these pesky humans that have these things like problems after they've been traumatised with robots that can kill without conscience. So it's a big issue. But coming back to yours, there's a very clear place for cannabis in post-traumatic stress disorder. It almost always should involve a sizable component of CBD, but it doesn't have to be limited to that. And in a sense, it's a question of, I don't know about a dispensary at Nimbin. We dream about the time where people can come into our dispensaries and have a choice of a range of cannabis. And as you mentioned, you can be offered, say, a sativa for daytime use, a sedating indica at night, a CBD one for background medication. There's a lot of subtleties we can apply, but until we get access to regular growing, which we're developing ourselves, we're not waiting, and analytical facilities, again, which we're not waiting for but setting up ourselves, we'll be able to offer a much more rational approach and a much better treatment outcome. Be very sceptical of some of the SSRI drugs. They worry about the safety of cannabis. We don't know what will happen in the long term. Cannabis has been in use for 4,000 years plus, probably much more than that. The SSRIs have been in how long? Have they been in use? How can they talk about long-term safety for any of their drugs? Because they rush them to market, they use you as the guinea pigs, and if they're unacceptably dangerous, they just make them disappear like vials. But no heads roll, right? Then they'll just launch another miracle drug, and we're constantly chasing this dream of the magic bullet, which doesn't actually exist.
Well, with the documentary that I saw, they were saying that troops were committing suicide less if they were to get them on cannabis, and unfortunately with post-traumatic stress disorder, what I'm looking at is cognitive therapy, and there's not much you can do medically with medicine with it because it just dulls the side effects, and then every time something bad happens to me, it gets worse, and it just gets worse until the person commits suicide. Yeah.
In fact, I think I might have mentioned earlier in the talk, I mentioned on the ABC interview, in Colorado, once recreational cannabis was legalised, there was a significant, measurable decline in suicides in domestic violence and in fatal traffic accidents. A significant measurable decline. In terms, just to finish on the PTSD and then we'll move on to something else, cannabis is not the only drug. Ecstasy-assisted psychotherapy has had wonderful effects in post-traumatic stress disorder. And a group called MAPS, the Multidisciplinary Association for Psychedelic Studies, they've actually battled for years to get these trials going, and their initial responses, I understand, have been very good. So the psychedelics can be useful for interventional therapy where you want actually to go deep into the mind and flush out a lot of those old memories and actually reset the brain. But in the short term, yes, CBD dominant cannabis is perfectly valuable.
Hello, I just wanted to ask for an alternative opinion. In the beginning of the year, I was given 1 to 4 months to live, maybe a year, and 3 weeks later I discovered it was somebody else's diagnosis, which devastated my life some. And then I've been epileptic since I was 8, and I discovered 36 years ago with my mother's help that whenever I smoked cannabis, I had less seizures. We experimented for 5 years, went to my favourite neurosurgeon, told him of our results, and he laughed and said, "We've always known this, but it's illegal." That was 36 years ago, and I only need that much every 3 days, and it alleviates my seizures. Before that, I was on every drug going with side effects, and I couldn't control my body. But they said that now I still have an aggressive cancer, but I no way I'm going to do chemoradium. I said when they gave me that 1 to 4 months, maybe a year, and if I had my whole sphincter and colon removed, I might live 4 or 5 years. And in my experience, I've done home hospice work in the past, and everybody just was at their wits' end wanting to live, and the doctors peeled them apart, cut them back, put them back together, and they all got their cancers back, and all those people died in a desperate need.
What was the question, though?
The question is, where can I go for an alternative opinion of a GP? I saw my GP on Monday, and she said, "Oh, it's advanced, and I think you've got 6 months to live." And I don't care for their opinion. It upset me. I need an alternative opinion who's into something else.
Listen, the allopathic doctors and there, "You've got 6 months to live." I mean, I once was in a tutor group with a very wise old doctor, and someone asked, "Well, how long have I got to live, doc?" And the old doc looked at him and says, "I don't even know." He says, "I don't know how long I've got to live," right? And that depends. Listen, it's very much like pointing the bone, right? They tend to have self-fulfilling prophecies. That's part of the issue. One of the great pleasures of our practice at the moment when we're using natural and cannabis-based therapies is to multiply exceed their gruesome predictions of instant demise.
36 years ago, I was given 4 to 6 weeks to live, and it didn't work. You know, had surgery, but I also had cannabis oil then, and that fixed me, but I haven't been able to obtain anywhere from anywhere.
You haven't been able to
obtain any cannabis oil.
That's a disgrace to the country. We should be able to help that. No names mentioned. Someone will tap you on the shoulder in the next half hour, I expect.
Well, first off, I just wanted to say thank you for coming out today and informing us all. My question is I work with some people with complex regional pain syndrome, and I just wondered if you could give any comment on the use of cannabis with complex regional pain syndrome.
Complex regional pain syndrome has been in the sort of ragbag of diagnosis for a long time, and people didn't really accept its reality and still working out what the pathophysiology is. But it seems very clear that it's some sort of reverberating neural circuit that's generating pain signals in the absence of tissue damage, right? Cannabis can certainly help, especially CBD dominant cannabis, but again, drugs like ketamine, especially ketamine pulse therapy, can have a really good reset function on that, possibly the other psychedelics, but we're not actually investigating in that way. It would be, ketamine would be my preferred intervention in the first instance, but it's difficult to actually organise.
I actually did have a successful ketamine infusion, so it was quite, I had a successful ketamine infusion in the hospitals, and it did work quite a bit. So I just wondered the use of cannabis, but thank you very much. That's great.
Okay.
Hello. I'm currently at UQ. I'm studying biomedical science. I intend to study medicine and actually to get into psychiatry eventually. I've got very interested in the work of MAPS and PRISM, for example, in Australia in terms of studying cannabis, MDMA, and the other potentially beneficial effects of using psychedelics, for example, as part of psychotherapy and all these processes. As part of me wanting to get into that kind of work, I'm inevitably going to be having to deal with academics who are part of this more conservative system of medicine and culture. Do you have any recommendations or advice on how to actually get into effective discourse when people are still dealing with all these cultural cringes around these substances, especially within these academic communities?
What people have to understand is 95% of the population support medical cannabis. Right? There is no cringe. This is still the last gasps of the Randolph-Hearst press telling you that there's an issue with it. There is not an issue. Right? Where you work will largely depend on what you want. Myself and a group have decided to run a parallel health system. We'll generate our own cannabis, we'll run our own consultations, we'll occasionally rely on imaging, blood testing and other modalities, surgery. Right? We're not against the intelligent application of allopathic medicine. Surgery, and especially in Australia, we have a very high level of surgery, luckily, is a very advanced and refined methodology when it's wisely practiced. Right, so I'm not against allopathic medicine generally. What we're against is basically the misuse of drugs, ironically. I mean, we've got a drug problem, but the drug problem is the SSRIs, it's the Ritalin, it's the statins, it's the Zoloft, it's the Stilnoxes. These are the drug problems that we've got. Where you fit in depends on what you want to do. You can go and put on a nice shirt and work at Sydney Uni and take 15 years to produce a meaningless paper, or you can get out in the real world and grow some pot and give it to some sick children. It depends what you want to do.
My fiance.
Okay, we've got about 10 minutes, is that about right?
Yes, that was my mind there. Yes.
I'll be quick. My fiance was just diagnosed with squamous cell carcinoma in her mouth, and she's only 26, so she's young. And it's in very early stages as far as we're aware, but we can't be sure until we go in for a proper consultation on Tuesday. Like, she's had an oral pathologist do a biopsy and it's come back positive. It's a fairly sizable ulcer under her tongue, and I understand that area is quite vascular. So she's been using for a number of years via a vaporizer, so not via conventional combustion methods. And I'm sort of I work with these things for a living, and I'm just sort of wondering, we ended up going and doing the same kind of thing as what you did, and getting some oil, and I'm trying to just sort of be a bit more discerning about who to trust and who not to trust.
Listen, the general question, it's a young lady, 26 years old, with a squamous cancer under her tongue, and the issue is what to do, how to balance allopathic treatment with cannabis and other therapy. It's a good question, it's a very important one. At this stage, I'll just give you a quick lesson on skin cancers, not just to digress, but I'll come back to you. Skin cancers come in different shapes and forms. There's one called the basal cell carcinoma, or the rodent ulcer, which can grow aggressively locally but can't metastasise. We've had some experience in treating them with topical oil, and on the whole, the results have been very gratifying, usually about a 3-week clearance, much longer for more complicated ones. We've had ones that are in very difficult areas, like across the nose, and involve deforming surgery. They've responded very well. At this stage, I don't recommend topical cannabis for the metastasising cancers like squamous or melanomas, for instance. I prefer that people go standard surgical, if it's available, resection, and then a dramatic change in dietary and lifestyle without even thinking about cannabis. If the tumour is not surgically resectable, then you get into a grey area, because there's an increase, and this is where it gets really ugly, there's an increasing trend to offer radiation or chemotherapy prior to surgery, the rationale being to shrink the tumour and make the tumour more resectable. What it does is generate stem cells, which makes the disease untreatable, and we normally then get a resection, and then 6 months later it's all over the place. But that's my experience. The best outcome is a surgical resection if it can be done, and then a dramatic change of what you're eating and how you live, rather than just focus on cannabis. I want to get people away from the fact that cannabis is what you reach for when there's cancer. You reach for the wheatgrass and the hemp seed and all these other things. Much more important to keep cancer away. The phytonutrients as a combined modality are much more potent than most other things.
So should C stop?
Stop what?
Stop ingesting the oil?
No, but my recommendation would be don't force yourself to have oil. Have the quantity of oil that maximises your well-being. Right? You're not looking at it, it's not going to cure that cancer just by vaping a bit of oil. She got it while she was vaping.
Yeah, no. So she's using the oil as like a mucosal membrane, like she's absorbing it through underneath her tongue.
Listen, yeah, that's all right if she's comfortable with it and the side effects aren't overwhelming. But would be lucky that it could reverse it because it's a difficult area to treat. But just be very cautious if they offer you radiation or chemo prior to a resection. I hope it's just well resected, but then you really got to get on to the fruit and veggies. Okay.
Dr. Katelaris, can I assume you might be available for discussion later on in the day? Yep. Okay, so we've got 3 more questions to go if possible. All right, let's go with one anyway.
Hi, my mum has been recently diagnosed with a very rare cancer. It's high-grade endometrial stromal sarcoma, and they believe it's stage 3, more stage 4.
What age was the patient?
She's 64. And they've gone ahead with chemo before removal because it's spread into the stomach. We're just wanting to know what dosages to take of cannabis oil, if it would work.
Listen, I'll tell you a sad little experiment we did, and it's a bit cautionary and not very optimistic.
Yep.
Like my experience with cancer, I mean, we saw how these things dramatically went away by putting a bit of oil on the skin cancer. But yet a lot of people have taken Rick Simpson oil and not got better. So my reasoning was we're simply not getting a high enough level. So even though it's a different cancer, ovarian cancer, we took 2 ladies about 5 weeks ago and injected into their abdomens, into their cancers, 12 grams of purified and winterized resin. Right? So remember, when you take oil orally, you only absorb about 1/10 or less of the dose. So say you take a mil of black oil, most of that is about 30% potency, so it's down to 300 milligrams, and you only absorb 1/10 of that, so you're getting 30 milligrams. Right? So you're not anywhere near any sort of tumoricidal dose. My hope was that by injecting it and bathing the fluid of the cancer with very high doses of THC, we could effect a cure where no other cure was available. Unfortunately, firstly, it was tolerated very poorly. There was a high degree of toxicity. We went for days because I just misunderstood the persistence of injected cannabis, right? Because even smoking is only 20% absorption. So you're getting 5 times more effectiveness when you inject it. There was initially a very gratifying, we ended up having to take the 2 ladies to hospital for IV fluids. Their vomiting and pain was so bad. And when I described to the doctors what I'd done, I mean, there was initially a fair bit of this is a fucking madman that's injected the ladies with cannabis. But the next week there was a very appreciable drop in the level of the cancer markers. So suddenly we were the best friends of everyone and looked like we were going to have a miracle. Unfortunately, a few weeks later, it's bounced back, and whatever benefit we had was transient. So the point I'm making there is that not all diseases are actually treatable by cannabis therapy, and you have to look at cannabis more just to make the other treatments tolerable. In terms of what you'd recommend there, that would have to be an individualised case, because it would depend on the details. You can't just give general approach to that. But what I would do, I mean, you can't rely on the cannabis to do anything other than to slow that down. It's not one of the responsive ones. And hopefully she can get a surgical access to that one. It just depends. But that's one of those problems that are a bit too hard. No?
Is there like some sort of like reputable naturopath or someone you can go and talk to about? Is there like a reputable naturopath or a doctor that you can go and speak to about these things? Because like she's seeing her GP and the surgeon, and they're not really promoting it, but they're saying there are good benefits.
Yeah. Hey, Nikki's going to be talking about the wellness clinic, isn't she? Hey? Oh, tomorrow. Oh, okay.
Narang.
Oh, right. You can contact the wellness clinic and have a consult either in person or by Skype if the patient can't travel. That's the best I could offer for that. Yeah.
3 very quick points with the influenza. If the randomised control, blah, 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 thank you, is the gold standard, obviously the meta-analysis is the platinum standard, and Cochrane have done that. There's absolutely no benefit from the influenza vaccine. There's no evidence that it prevents influenza. There's also no evidence that health workers who are vaccinated...
No, listen, I'll make a few little interventions there, because the influenza story is interesting. Back in 1974, Richard Nixon, he tried to mandate influenza immunisation. They were going to make a mozza, but they rolled out 300,000 doses and got 30,000 cases of Guillain-Barré syndrome. Guillain-Barré is ascending paralysis, where you go to bed normal and you wake up with only your waist and above working. Very, very distressing. Did they can the influenza program pretty quickly, but no heads rolled. They didn't do any testing on that. They left it 20 years before they tried again. Now, this is a sad bit. An influenza virus has core antigens and surface antigens. So when you talk about N1H1, they're talking about neuraminidase and hemagglutinins on the surface. But there's a thing called the core antigens. And Australian scientists have developed a vaccine, not a vaccine, an inhalant immunisation against the core antigens. And all the influenza has the core antigen. You'd only need one, just a sniff every 7 years to give you true mucosal immunity. This is complete bullshit. This is non-science. This is basically raping the patients for financial benefit.
I probably wouldn't put it quite as strongly as that, because I'm still in the system. So I have to moderate my language. To the lady with talking about medicinal marijuana, you will never find a psychiatrist who will agree with that. It comes down to the relative quantity of THC delta 9 and THC 25. Sorry.
Hey, what's your question?
My question is, why the hell can't she get the advice that she needs to get the treatment she needs?
Well, firstly, there's a number of reasons. Firstly, there's a lack of quality cannabis. There's a lack of trained practitioners in the area, and and also a lack of knowledge. I mean, what we're going to be doing in 3 to 5 years is we're going to look back at whatever we're doing now as primitive. So we don't know what we're doing. We're learning that, but we'd learn a lot quicker if we could get access to analysis, right? So we could look at the whole fingerprint of the plants that we're using. The difference between the way I do science and the way the guys in the white coats do science is this. If I wanted to find out what the medicinal values of cannabis was and the role of the cannabinoids and the terpenes, I'd do a dispensary. You'd set up 20 types of cannabis, varying from pure indica to pure sativa and all the way in between, and allow the patients over a period of 6 months to trial the different cannabises. And very soon, you'd see if there's a correlation between the guys with spasticity or the people with epilepsy or the ones with chronic pain. They're all gravitating because the patients are cleverer than most doctors that I know. They know what's wrong with them, but they know how to fix it. They just need to be given the opportunities. So the reason we're not going anywhere is because I've got someone like Kerry Chan, the Chief Health Officer of New South Wales, blocking the university cooperating with us. Right? But yeah, we'll get there. We'll overcome. We've made great progress and we're sort of unstoppable now.
I do feel less angry and anxious when I smoke it, and I can control my emotions a lot better. That's what I've found with what I've got from leaving.
You find yourself angry?
I find myself less angry and
oh yeah, sure.
And I can control my emotions a lot better, make better decisions when I smoke.
Yeah. What we're trying, and
my post-traumatic
Yeah, especially with the CB dominant cannabis. I mean, I'm just starting to experiment with autism now. Like, I like to have an understanding of the diseases that I treat, but I have to say I have no understanding of what autism is, what's causing it. But the only thing that's going off, there's big red lights going off. When I see these kids, these are seriously dysfunctional kids with no hope of reversing it at this stage. They're just basically drugging them into submission. It's a major disaster because a population that doesn't look after their new generation, their children, is nothing. Right? It's just one step away from extinction, and maybe that's what we need.
All right. Well, I think we should all thank Andrew